Hi, Mr. Thomas. How are you doing today?
I'm doing good.
My name's Melissa. I'm going to be your day nurse. Okay, I just wanted to come in and do a little bit of an assessment. Is that okay with you?
Sure.
Okay, do you mind if I check your ID band? And as I entered the room, I will have performed hand hygiene as well. Obviously, I don't have that here, but I will have done that. All right, so Mr. Thomas, do you mind just stating your name and date of birth for me?
My name is Christopher Thomas. My birthday is July 4th, 1986.
Okay, perfect. And I will have also noted his MRN to make sure that it matches what is in my chart. All right. So, Mr. Thomas, do you know where you are?
I'm at VC Medical Center.
Okay, good. And do you know what day it is?
Today is April 16th, 2020.
Perfect. Okay, and with speaking to Mr. Thomas, I will have noted that his speech is clear, coherent. His breathing seems open and unlabored, which I'll assess more with lung sounds later. And with his ID band, I will have noted that as I touched his arm, that his skin is pink, warm, and dry. Okay? So, Mr. Thomas, do you have any allergies at all that we should know about?
I'm mildly allergic to cats.
Okay, I'll make sure to note that in your chart. And I will have also looked at Mr. Thomas's vital signs to make sure, and I will have compared them with anything that we took earlier as well. Mr. Thomas, have you been experiencing any pain at all?
I have not.
Okay, good. If Mr. Thomas were experiencing any pain, I will have asked him about the quality of the pain, just kind of to describe it, how long it's been going on, and what makes it better, what makes it worse, and if he takes anything at home for this pain, if that helps. If we were giving him any medication in the hospital, I would ask him if it is helping at all, and we would adjust his treatment as needed. Okay? Also, there are no tubes or equipment drains noted. However, if there were, I would check the patency of the tubes, follow them from the point of entry to the source, make sure that everything, like all of his IVs, any fluids are all correct. I would check the settings on any equipment as well, the rates, and the IVF as well. If there were drains, I would check any output and note that in the chart as well. All right. So, Mr. Thomas, I'm actually going to start my physical assessment, but I'm going to start with your eyes and your mouth. Sure. Do you mind just taking off your glove? Good. All right. So this is going to be a little bit of a bright light, but it won't be for long. I'm just going to check the reaction time of your pupils, okay? But I am going to take a quick look at them first. Just kind of compare them. Perfect. Okay, I've noted that Mr. Thomas's pupil size is about 5 millimeters. Okay, so I'm going to go ahead and shine that bright light. All right, good. Perfect. Okay, and go ahead and follow the pen light for me. Okay, and I'm going to go ahead and start from far. I'm going to bring it closer. Just follow it as I do. Okay, perfect. Do you mind opening your mouth for me? Okay. So after inspecting and assessing Mr. Thomas's eyes and mouth, I will have noted that his face is symmetrical. His face has a relaxed expression, and his mouth is pink, moist. Teeth are all intact. Mr. Thomas, do you have any issues swallowing at all?
No.
Okay, I will also note that in the chart. When performing my Perla assessment, I will have noted that his pupils are his pupils are equal, round, reactive to light, and accommodation. Okay? All right, so Mr. Thomas, I'm actually going to go ahead and listen to your heart and lung sounds if that's okay. Mm-hmm. All right. So just breathe normally as I listen to your heart. And have you had any issues with shortness of breath, any problems breathing, any chest pain at all?
No.
Okay, good. Okay. Okay. So just relax as I listen. Okay, sounds good. I will have noted that Mr. Thomas's heart sounds, both S1 and S2, are present with no abnormal or heart sounds noted or murmurs. Okay, so Mr. Thomas, I'm actually going to go ahead and listen to your lungs. Every time I place my stethoscope, I just want you to take a nice deep breath in for me, okay? I'm going to go ahead and just reach over. You just take another deep breath in for me. Okay, once over here. Okay, if you don't mind sitting up, it can just help you up a little bit. I'm going to listen to your sounds in the back. Once again, as I place, just take a deep breath. Go ahead and sit back for me. Perfect. Okay, after listening to Mr. Thomas's lung sounds, I will have noted that they are clear and present in all lobes, both front and back, with no adventitious sounds noted. All right, so Mr. Thomas, I'm just going to ask you a couple questions. Have you been passing gas normally?
Yes.
Okay, when was your last bowel movement?
This morning.
Okay, good. Have you been eating regularly? Your appetite's been good?
I have been eating good. I have not been nauseous or anything.
Good. All right. I will note this all in his chart as well, just to be sure. And if he had any wound dressings on his abdomen, I will check that in a moment as I pull his shirt up. But I will make sure that everything's intact. That I will check the skin integrity, make sure there's no drainage at all. And if there is, I would note all of that in his chart. So I'm going to actually listen to your bowel sounds and then just kind of check your abdomen, if that's okay.
Sure.
Okay. Okay, do you mind if I pull your shirt up a little bit? Okay. All right, so I'm just going to press down a little bit. Just let me know if you experience any pain, tenderness.
Okay.
Okay. Anything over here? No? Okay. I'm going to check this side. All right, I'm noting that his skin is pink, warm and dry. No lesions that I can see. His abdomen is symmetrical, soft, and non-tender. Okay. And there's also no distension noted. All right, thank you, Mr. Thomas. So I'm going to move on to his upper extremities. Mr. Thomas, are you experiencing any numbness, tingling, weakness?
No.
No? Okay, that's good. Do you mind if I just take a look at your arms? Okay. There are no lesions noted on the left arm. No lesions noted on the right arm. All right, do you mind if I just squeeze your finger a little bit? Perfect. His cap refill is less than 3 seconds. Do you mind if I check your pulses?
Sure.
Okay, just relax for me. Okay. His pulses are strong, equal bilaterally. I've also noted that his skin is pink, warm, and dry. I'm also going to ask you if you can just squeeze my hands. Perfect. I'm going to pull a little bit. If you can just pull back. Perfect. And I'm going to push you a little bit. Promise I'm not mad at you. Just push me back a little bit. All right. Great. All right. Strength is both strong and equal bilaterally as well. All right, do you mind if I move down to your legs? I'm just going to pull up the blanket a little bit. I promise it won't be for long. All right. Upon inspection, I'm going to check for any edema lesions noted and whether or not the temperature or the color of his skin as well. All right. There's no edema noted, no lesions. His skin is pink, warm, and dry throughout. Okay. All right, I'm just going to press on your big toe if you don't mind. Okay. Cap refill is less than 3 seconds. Okay, so I'm going to check the strength of your legs as well, if you don't mind just pushing on my, there you go, and then pulling back. Perfect. All right, strength is good and strong and equal bilaterally as well. I'm also just going to check your pulses to make sure that they're good. Sometimes it takes me a second to find these, so. Perfect. All right, pulses are strong and equal bilaterally as well. Okay. Okay. Mr. Thomas, if you don't mind actually sitting up for me, I'm just going to check the skin on your back. Okay. I don't note any, go ahead and sit back for me. I don't note any lesions on his back. His skin is pink, warm, and dry. And in a hospital setting, I would also check the buttocks for the same things. So I'm actually just going to kind of, all right. And so skin turgor is also good. Mr. Thomas, how has your hospital visit been?
It's been good.
Okay. Everyone's treating you well? Nurses, doctors, taking good care of you?
Yes, I'm getting excellent care.
Great. Do you need anything right now?
No, ma'am.
Okay. Well, I'm going to leave you with your call bell. So just let me know if you need anything at all. I'll be back in a little bit to check on you as well. So yeah, just give us a ring. Okay.
Thank you very much.
All right. Thank you.